Good morning, London. Namaste, India. Selamat siang, Indonesia. Selamat petang, Malaysia, and Hoop Apran, Bangladesh. Myself is Joby George. I'm the regional faculty lead for the Global Health Network and the Global Research Nurses Network based in University of Oxford, London. Welcome you all to the first ever webinar of nurses titled Experiences of Nurses in Navigating Practical Challenges During the COVID-19 Pandemic. A webinar with nurses from 4 Asian countries. This webinar is brought to you by Global Research Nurses Network and the Global Health Network, the Burden Trust for Nursing, and University of Oxford, London. Thank you all for your patience and support. I am delighted to be joined today by Captain Dr. Usha Banerjee from India, Dr. Tukimin bin Sanswito from Indonesia, and Dr. Sandra Rumi Mathu from Bangladesh. We are hoping to join Professor Abdulla from Malaysia soon to our webinar. Together, we will bring together the experts in the field from Asia to share their experiences in unique challenges in conducting research during the outbreaks and how they navigated them to deliver high quality research is what we are aiming forward from this webinar. To move ahead, may I request my colleague, Arantxa de la Hora Gozal, who is a clinical research specialist, our midwife. She leads the research team at the Global Health Network. May I invite Arantxa to just talk on the introduction to Global Research Nurses Network. Over to you, Arantxa.
Thank you, Joby. I hope you can all hear me well, and good morning, good afternoon, depending on where you are. And my name is Arantxa de la Hora. I coordinate Global Research Nurses Hub at the Global Health Network. And welcome everyone, and it's a great opportunity to be part of this webinar and to be able to introduce Global Research Nurses to you all. I will just spend a few minutes providing a short overview of Global Research Nurses, the Global Health Network, and the new and exciting opportunities that we have just launched. Here at Global Research Nurses, we want to provide you all nurses and midwives with the support, guidance, and information that you need to fulfill your role and enhance your career as a nurse involved in research. Because by getting involved in research, you will play a vital role in providing and improving patient care. Global Research Nurses is a network created to build a community of practice for nurses. And this community enables nurses and midwives to engage, learn, seek opportunities to work in health research, and ultimately develop and lead their own studies. And we focus on low-resource settings. By getting involved in research, nurses can play a vital role, as I said, in improving patient care, since research is the only evidence-based method of deciding whether a new approach to care is better than current practice. Research experience empowers nurses and midwives. It means knowing what that what you are doing is right and that is evidence-based. We must, as a profession, be responsible for providing the evidence for our own nursing and midwifery practice, as well as understanding, interpreting, and assimilating all the relevant research from other disciplines. So we see research is key. And here at Global Research Nurses, we offer from templates to checklists, anything you need for your next research project. In our events sections, we have a list of upcoming free webinars and workshops for nurses and midwives. And the e-learning section offers lots of free e-learning and certified courses to provide research nurses with training on how to design, planning, to run the operational side of the study, and reporting your health research study. And you can also follow us on Twitter to get instant notifications on upcoming events and research updates here at GRN Research Nurse, GRN Nurses. Global Research Nurses is led by regional faculty leads, as you've met Joby, who are research nurses in Asia as Joby, or Africa as Ralwiki, and we are currently looking for some research nurses in Latin America. This faculty leads organized research capacity strengthening workshops, training programs, skill sharing activities in the regions. And some of our upcoming projects that we've been working on together include a nurse-led study database and also creating an animation to engage nurses in research. And this is very exciting. We recently launched the Global Research Nurses Palm Priming Awards 2021, and we've made available £20,000 of funds for small palm priming grants for between £2,000 and £10,000. And this is specifically for nursing and midwifery-led research projects and relevant to low and middle income countries. So you can use these funds for 3 activities. As I mentioned, as a palm priming grant, it can be used to cover the cost of conducting a new small research project. Typically, is a proof of principle studies to facilitate further funding from other funders, or to fund an exchange visit to or from another area working on the same nursing or midwifery research project, and with a view to developing a collaborative project. And also it can be used as to host a local, national, regional workshop about nursing and midwifery research with a view to subsequently develop a project. Please visit our opportunities page at Global Research Nurses for more information. And please note that the deadline is the 17th of September. So a couple of weeks to go. And Global Research Nurses is not alone, it's part of the big Global Health Network family. And this has knowledge sharing hubs, as you can see on the screen. There are loads, there are more, on areas such as maternal and child health, infectious diseases, non-communicable diseases, research processes and methods. We also have research tools such as the professional membership scheme, process map, or site finder. That is a tool to link research sites with collaborators planning research. Next. Research resources with hundreds of free and open access resources found across the whole of the Global Health Network. And this gateway will point you to guidelines, tools, templates, web app, database, anything you can think of, crowdsourcing initiatives, webinars, workshops, training material, as well as links to external resources, all that are relevant to health research, themes, regions, and or diseases. And also we have a training center providing free certified online e-learning courses translated in different languages. And as members of Global Research Nurses, nurses and midwives can also access all the general research and health resources available across the Global Health Network. And how can you get involved? First, join Global Research Nurses if you haven't done already, it's free. And you can access it from that point. You could maybe think about introducing yourself, complete the Inspire interview questions to introduce yourself or your team. You've got the link there, or you could think about promoting local training opportunities, and we could do that through the network, through the hub, or design and host a workshop in collaboration with us. So you've got our email there, nurses@theglobalhealthnetwork.org, and we would love to hear from your plans and initiatives. It's just a note acknowledgements. Thank you very much. Thank you, Joby. Back to you.
Thank you, Varanja. It was an absolute short and sweet presentation about our Global Research Nurses Network. Thank you very much. To move ahead, may I request all the participants to use the chat button to introduce yourself as and when our webinar moves on. The biggest advantage of today's webinar is that many nurses have been joined from India, from Bangladesh, from Indonesia and Malaysia. It has been a great webinar that I think that since the COVID-19 has erupted, this is the first webinar wherein such a great number of nurses have been joined. And apart from that, the exceptional quality of today's webinar is that we have been joined exceptional speakers from India, from Bangladesh, from Indonesia, and we are hoping to join the Malaysian speaker as well. It is my great pleasure to welcome Captain Dr. Usha Banerjee. She is an alumni of the College of Nurses, Armed Forces Medical College, Pune, commissioned into the military nursing service in 1989. She's been bestowed with the President's Medal and has been a recipient of many national and international awards, including the Healthcare Management Asia Awards, the National Women's Excellence Award also. She is recognized in the Apollo Group for her leadership style, management abilities, and contribution to clinical excellence and business outcome and innovation. It is my great pleasure to welcome Captain Dr. Usha Banerjee to this exclusive webinar. May I request her to talk on the topic strategies and role of Indian nurses in fighting COVID-19 pandemic. Over to you, Captain Banerjee.
Good afternoon. It indeed is a great pleasure and a privilege and an honor for all of us here in the country to attend this webinar of the 4 Asian countries. Let me just put my slide on a full show. Yes. My sincere gratitude to Mr. Joby, George, whom we all are proud of as Indians for doing some commendable work in the space of clinical research. It's a privilege to know you, Joby, and I honestly, from the deep down my heart, I know that your passion is going to drive clinical research in our country and take nursing to the next heights. My sincere gratitude to the Global Nurses Research Network. I'm sure our partnership is going to evolve and it's going to have a lot of nurses enrolled into the research program. My sincere appreciation to all my fellow colleagues, leaders, nurses who have joined in here on this program today to cheer me up, and also friends from outside the country if they're listening to me today. Special mention of Treza, who is going to talk about the experiences of the nurses in the COVID unit. On that note, thank you once again for this wonderful opportunity, and let me take you through what I have to speak today in this next 20 minutes. So traditionally, namaste. And I think the world has adopted namaste today. Greetings from all the nurses of India. The nursing fraternity of our country salutes all the nurses across the world, and we honestly pay homage to all the COVID martyrs. So let's look back on what the pandemic did and how it impacted nursing in India. So before I move into the COVID challenges, I would love to take you through a journey of my beautiful country, the incredible India as it is called. One of the oldest civilizations, a kaleidoscope of rich cultural heritage. It has achieved significant progress socioeconomically since its independence. India pulsates with a spectacular mix of tradition, people, culture, and the colors of India. We relish our age-old principles of harmony. And today, as I talk to you, you notice that I'm dressed in my traditional attire and I represent the beautiful colors of India in this bright yellow sari. And I hope this message goes down to every Indian that we are still proud to be an Indian despite all our challenges here today. The country is now prominently placed in the map of the world as a prominent destination for global health, for medical tourism. From the beautiful mountains of the Northern Hemisphere to the sun-bathed sandy beaches of the South, the Eastern coastal plains and the Western Ghats, India vibrates with a spectacular mix of tradition. This country is home to some of the most remarkable men and women who have walked the earth. From the non-violence movement of Mahatma Gandhi that's etched in history forever, to the compassionate, caring attitude of Mother Teresa, to the groundbreaking mathematical revelations of Ramanujam, the zero of Aryabhatta. Well, this is home to some of the legends that the world has produced. India today is as good and one of the best in the world. This country is known for its healthcare today because of its accessibility, affordability, and cost. This is my beautiful country, heritage, nationalism, diversity, illustrious and amiable. And I'm proud to say that I'm an Indian. Why 2020 will forever be the year of the nurse? We all know that WHO had declared 2020 as the year of the nurse, and probably none of us even ever imagined that nurses across the world will have to face the challenges that they did face. But every country, every nurse rose up to the occasion, truly making it the year of the nurse. And I know the spotlight has changed. The attention has come for the nursing fraternity across many developing countries, and hopefully the future will become the era of the nurse. We all know that the country was ravaged and torn apart with the COVID crisis. Stories of overwhelmed hospitals, underpaid nurses, overworked nurses, lack of PPE, everything being compromised across the world, and where states were being forced to bet against each other for ventilators, for doctors, for nurses, the dilemmas, which patient to look after, which not to look after. My God, these were the most powerful countries of the world. The tragedy was immediate, real, epic, unfolding before our eyes. A poor man's sickness could affect a healthy society, a wealthy society. So what about my country, my rich, poor country? What about India? And researchers in India were trying to pinpoint what was the reason behind this unprecedented surge. Was it an unfortunate confluence of many factors? Was it emergence of a particular strain? Was it because of the low vaccine coverage? Every single human being turned into an epidemiologist, a virologist. Everyone was a quack around, statisticians, prophets. But I know one thing, that every saint, every doctor, every nurse, every citizen of our country today is praying for a miracle. India was suspended somewhere between feudalism, religious fundamentalism, caste, capitalism. While China was fighting this outbreak, India was dealing with a mass uprising of hundreds of thousands of citizens protesting against a law that got passed in the parliament. As an appalled country, world watched, we saw many migrants walk across on foot to their villages. The fleeing population could have taken the virus to the villages where health infrastructure is very, very rudimentary, adding further burden to the nurses. State borders got sealed. People got diverted to camps. And the lockdown, which was enforced for physical distancing, probably had resulted in the opposite and on an unthinkable scale. And these pictures, mass cremations, were heartbreaking. News and media, there was so much of an information circulating on the news network. Some amount of information showcasing crisis, making it mass frenzy. Some was unreliable, spreading rapidly like a virus and making solutions more difficult to achieve. We all knew, reading these newspapers, that we as common man, even though we are nurses and healthcare employees, are going to have the struggles of a lockdown. Supply chains were broken, medicines, essential supplies ran low. There were prevailing prejudices of religion added to our woes, mass gatherings. Hospitals admitted largely only COVID-19 patients. What about the other emergent, urgent conditions? Many of it went on hold. This slide shows to us that even the best of our metros, which have got better infrastructure than the rest, still continue to wreak havoc. And you see on this that including Delhi, where I sit today, the capital of the country, where the havoc was maximum, tore us apart. Every single nurse had to face the wrath of this COVID virus. This is some of the most reputed hospitals of our country, where a lot of people from across the world travel into, including our premier institution, the public health system here, and the best of hospitals with finest infrastructure, super specialties, advanced technologies, skilled medical resources. All these hospitals were bursting at their seams and they were overwhelmed with a crisis. So what was India's response to COVID-19? So like any other country, India's response has been complex. It has guided by the existing health infrastructure which is available, the scalability of all our resources, which include our nurses, doctors, and paramedics, the strategies to counter the infection, and the rapidity in establishing our vaccination program, and the economic feasibility of a lockdown. So, like any other responsible country, you notice that our Prime Minister attended the World Leaders Forum, which spoke about various strategies. And we are proud that India had a representation in this space, so we could access the world's best policies in order to handle our own crises. So what happened is we stood firmly to manage this unprecedented challenge despite being torn apart. Our government and non-governmental agencies pressed and augmented support like never before. We had established a lot of diagnostic and research facilities. Tracking services were in place, and they have been augmented further since the COVID hit the country. Our vaccination program has gone to the next level. And India is also known for its traditional medicine and Ayurveda. So the Ayush ministry could press out a lot of information and advisory to common man in order to practice Ayurveda. And I'm so proud to say that nurses have led from the front line, beating all odds with courage, grit, care, compassion, competence to serve all those who were in need. Many, many countries have extended their support to India. I don't have to say which country. We got relief material, medical supplies, oxygen concentrators, and all those that could be given to our patients here. Nurses and nursing associations, especially nurses of Indian origin at different countries, stepped in to provide education, relief material, and mental health support, or any form of support that they could be. Our Indian Nursing Council, which is our regulatory body, came up with a lot of training initiatives which nurses could access and train themselves upon to manage the crisis like never ever before. Trained Nurses of the Association of India, which is yet another large association of the nurses, has also stepped in a big way. The Association of Nurse Executives of India, which I am proudly a founder member of, which was established for the very same purpose of educating nurses and being support to others, have extended enormous support to nurses. And I'm so glad to be a part of it. So this is what the nurses experienced. It was like a perfect storm, a combination of unprecedented surges of patients, the challenging conditions, the global pandemic not abating, it's coming back again and again, and we are all now told there's going to be yet another wave, a new normal, a new way of working, adopting technology. Goodness gracious, it's been a crazy year. Scarcity of nursing resources has always been the biggest challenge that one could ever face. You know that nurses in India are the most sought after, and our hospitals have a huge attrition because our nurses are known to be one among the best in the world. So even before the onset of the pandemic, India was suffering from a shortage of more than 2 million nurses. And today, as per the WHO norms, India is in need of more than 4.3 million nurses by 2024. Yet, despite all these challenges, nurses have played a key role in India's fight against COVID, filling in the gap which is left by dismal ratios, whether it is doctor to nurse, doctor to population, nurse to patient, nurse to population ratio nationwide. So what were the challenges faced by the nurses? There was a sudden surge of patients. I myself in my hospital had to accommodate 3 times the number of patients that I would have on a full occupancy. And we were forced to admit these kind of patients irrespective of what kind of resources or infrastructure we had. There has been a short supply of personal equipment, protective equipment, and other critical resources across many, many hospitals in the country. Nurses confronted many challenges and dilemmas like any other professionals have experienced across the world. Ethical obligations, whom to resuscitate, whom to care for, whom to leave around. These were stressful times for every single nurse. And the nurses who were at the rural areas have borne the toughest challenge to battle against this coronavirus pandemic. So shortage of nurses in the hospitals, even student nurses had to be deployed. And I'm fortunate that we have a good curriculum and we train nurses up to speed to step in and take care of the patients. Most of the goals of occupational safety of healthcare workers got breached. There were frontline workers who had to step in with minimal protective equipment, which was pretty risky and scary, and this fear of the unknown amongst the nurses. Amongst these nurses, psychological stress due to lack of trust in the effectiveness of their PPE was yet another concern. And unavailability of accommodation and transport facilities added to their problem. And this was lockdown time. People had to travel to work. So it was important for us to give them accommodation around their areas of work. Not all could do it. Physical exhaustion and mental stress, we all know what it means to be in a PPE for long hours without a bio break. And it's terrible to be in those sweaty PPEs for very, very long time. And all the nurses across the world have faced this. Insurance coverage in case you fall sick was yet another concern at the beginning. Concerns regarding personal safety and security at workplace. There was a social stigma attached to people working in healthcare. There was violence amongst healthcare workers. And it was terrible to get back home when people had another view of nurses or any other healthcare workers working in the hospitals. Lack of counseling in distress, communication gap between hospital authorities and nursing leaders. There was a lot of frustration around every single worker, and this led to exhaustion. This is just a view of all that we went through, going to rural areas, remote areas for vaccination, or leaving behind families. Many of our workforce is very, very young, leaving behind small babies and coming to work has been pretty distressing. With all these odds, I'm proud to say that our nurses have literally opened the door to the most painful but most rewarding moments in the lives of others. I think one of the best moments is that the world around us in this country started recognizing the efforts of nurses. As I said, the spotlight turned onto the nurses. Ours is a very doctor-driven healthcare system, very patriarchal, traditional, orthodox. But today, when they talk about doctors, nurses, and this came right from the Prime Minister. And if you notice this, people stepped out of their homes to applaud for nurses, and our president himself doing that to lead the way. The military, defense services, Indian Air Force, in a fly past, showering petals on COVID warriors. And I'm proud to say that I had a fly past around my hospital too. It's a great moment. It's a great honor, which pushes us to do much more. and beyond. Some of the initiatives that the government has taken is to give coverage to healthcare workers with an insurance and for whenever they fall sick, and also for violence. So that's a good step. And I think these are things that keep our workforce going. A few recognitions like never before. If you look at media stories, they were covering a lot of nurse stories, and young nurses stepped in to make news. This is one of our nurses whom we are very, very proud of, Mr. Raju Jose, who had gone to Wuhan to evacuate the Indian nationals. He got a recognition from the minister himself. The BBC covered stories. The Chief Minister of Karnataka gave away some award in public to nurses. And I think these national and state recognitions mean a lot. I think that's going to impact change in the nursing profession. This is a story that has touched everyone's heart. This is a nurse who usually does her duty in a Naxal-prone area in Chhattisgarh in a makeshift boat through a river infested with crocodiles, going to discharge her duties. I think there are such great, brave stories, heroic stories, which will always remain in our hearts as nurses who went an extra mile in their call of duty. Social media was again viral with nurse thank you stories. So that's yet another thread that got picked up and highlighted. So this means a lot for community and citizen recognition for nurses in the country. Nurses who started to vaccinate all our key leaders and celebrities all became celebrities themselves. So everyone has a story to tell. Their villages recognize them, their hospitals recognize them. So it's a great moment for nursing in the country here today. How are we getting prepared for the next wave? I think we have learned our lessons. There is some insight. We are trying to prepare up so that we are not caught by surprise and we are not going to get torn apart the way we did in the past in the second wave. So the government, the hospitals, the nursing fraternity themselves are trying to gear up by training people, looking at infrastructure, looking at procurement and supplies so that we will not be caught off guard. So in continuation, I think there's a lot of back-end work happening in order to predict the third wave, how potent it is going to be, how it is going to hit India in the couple of months to come, and all that. And I know that nurses are an integral part of this decision-making process. So what the future may hold for us, nursing leaders have to spend time planning and preparing the workforce. Nurses should go an extra mile, should not quit jobs at this moment. The country needs us. The citizens need us. The healthcare is still beaten up by the COVID pandemic, and there is a surge anticipated. We want every young nurse, retired nurses, everyone to join hands to make this country a better place. Nurses have to be savvy. Nurses will have to ensure that they are part of every aspect of this healthcare system. Research. There's a lot of research that we do in our country. While we are busy managing our patients and the crisis now, we all need to know that there has been a lot of work that went into COVID, which could become the base of our research programs in the days to come. So nurses must step up and publish their learnings. So the current crisis should accelerate the future of our work, but the question remains. We are a resilient country. We are adaptable, and our country promises us that we will bounce back and we will have a better future, and that our civilization will not disappear. So Jai Hind, thank you so much from my end. Namaste.
Thank you, Dr. Usha Banerjee, for wonderfully depicting the entire picture of India and the way ahead in handling the pandemic. It is indeed great to hear from you, and thank you very much for your valuable time. It is my indeed pleasure in welcoming Professor Tukumin bin Sansvito. He is the current president of Indonesian Nurses Association. He's a senior lecturer in nursing and public health at Lincoln University, Malaysia. He holds a PhD in health sciences along with a master's degree in nursing and public health. It is my indeed pleasure in welcoming Dr. Tukumin to this webinar. May I request you to kindly overview on the topic role of nurses associations in Indonesia in tackling COVID-19 pandemic. Over to you, Dr. Tukimin.
Okay, my name is Dr. Tukimin from Indonesia. I would like to present about the roles of nurses association in pandemic era. Role actually is what the people expect to the nurses. Similarly to the nurses association, because nurses association Indonesia actually is a professional body. Yeah, but maybe we need to introduce, but the nurses association Indonesia little bit differ. Yeah, if we compare with other countries such as in Malaysia or maybe in UK and others, because nurses association actually different with the nursing board. Yeah. Okay. We start with the COVID-19 disaster in Indonesia. Maybe this term is look like funny. Why? Maybe because I use the term disaster. Yes, because in Indonesia, actually the government treat disaster. Treat the COVID-19 as part of disaster. Therefore, everything follow the sequence and the rule and regulation and the law. Everything actually follow the disaster regulation. Before we start to explain everything about the role of the nurses association in Indonesia, we have to start with some evidence. Yeah, the total case in Indonesia, patient with the COVID-19 today actually over than 4 million. Then total death actually over than 135,000. Meanwhile, the recovery actually 3 million and 837,000. The recovery rate is actually 92.94%. The non-in treatment actually there are significant number here. Then the fatality rate 3.29%. This is actually taken from the outbreak live update today. Yeah. So what related to these issues? Yeah? Because all of these issues affect all of the human life, specifically nurses. This case actually affect the physical, the mental, the social, and the spiritual of nurses. That need attention from the nurses association in Indonesia. Just now I use the term of the disaster because in Indonesia, COVID-19 treat a little bit differ with other country. Maybe if we compare with Malaysia, Singapore, Thailand, or maybe in India, basically they consider as the the health issues, maybe the national health issues, that treat maybe by the Ministry of Health. But in Indonesia, COVID-19 classified as the pandemic, and the under treatment or under management of the disaster management authorities. So before we start to discuss about how the government in Indonesia treat the COVID-19 disaster, so maybe we need to review this one. The disaster actually is an incident or series of incidents that threaten and disrupt people's life and livelihood, resulting in human casualties, environmental damage, losses, property, and the psychological impact. The natural disasters are disasters caused by the nature, including earthquakes, tsunamis, volcanoes, eruption, flood, hurricanes, and landslide. The non-natural disasters are disasters caused by technology failures, modernization, epidemic, and disease outbreak. Maybe we have to highlight that actually COVID-19 in Indonesia considered as part of the disaster case, actually under the disease outbreak. Actually, the pandemic considered as the disaster in Indonesia. Therefore, because of the system in Indonesia, the COVID-19 actually one disaster case. Everything follow the law of the disaster management in Indonesia. Based on the law number 24, 2007, yeah, state that the country of the Republic of Indonesia is responsible to protect the entire Indonesian nation and all of the Indonesia's region with the aim to provide protection for life and livelihood, including protection against disaster. So we have to highlight it, yeah, because this is actually our main issues related to disaster. In the context of realizing public welfare based on the Pancasila as a mandate in the 1945 Constitution of the Republic Indonesia. This may be the main law held by the Indonesian government to treat pandemic COVID-19 in Indonesia. Related to nurses association, so we have to understand where is the position of the nurses association. Previously, I have stated nurses association in Indonesia a little bit differ with the in other countries, in Malaysia and UK and others. So we can see here the position of the nurses association in Indonesia, how their conduct to treat and participate to eliminate and to prevent the COVID-19 infection. Basically, Indonesia has recognized what we call it as the gotong royong system. Actually, gotong royong system actually is the most famous social culture values in Malaysia, also in Indonesia. Gotong royong means together. Together. I mean, actually multi-sectoral. Multi-sectoral that involve everything that related to the system. The system gotong royong actually managed by central government. In this case, actually directly. Previously, the President Joby actually managed all of the gotong royong system to eradicate and to control the COVID-19. Then maybe if we compare with in other countries, in Malaysia and Singapore, UK, actually Ministry of Health will hold a very important role to control the disease and to manage the disease. But in Indonesia, different, not like that. Ministry of Health only manage their own ministry activities because basically Ministry of Health there has the healthcare professionals such as medical doctors and nurses, maybe pharmacists, physiotherapists, etc. In Indonesia, all of the healthcare professionals stay in their own system under Ministry of Health management. Then some of the policy actually given by the central government, then Minister of Health in general will correspond to the policy the central government. Actually, as the frontliner in the hospital, that is the main role of the Minister of Health in Indonesia. But indirectly, the entire the program control for COVID-19 actually central government give to the national body for the disaster management. This might be different from other countries. And national penanggulangan bencana, that is the Indonesian term. Then the first action of the national body for the disaster management actually will already form what we call it as the SARS-CoV. SARS actually is task force COVID-19. Task force COVID-19. So what is the task force COVID-19? Actually, the main function of the task force of the COVID-19 actually to prevent to treat and to control the disease. Then who? Multidisciplinary volunteer. So who inside of the multidisciplinary volunteer basically is medical doctors, the nurses, physiotherapists, pharmacists, police, army, etc. So many volunteer here, then work together under national body for the disaster management. So what contribution of the nurses actually? Nurses has contribution when they are join as the multidisciplinary volunteer under SARS-CoV or under the task force of the COVID-19. Because just now I have explained to you that SARS-CoV actually is multidisciplinary, include nurses. This might be one important role. In this context, actually, nurses only give the synergy correspond to the existing system managed by the national body for the disaster management. So how about the nurses association? The role of the nurses association actually just important to manage their own family in the organization. Normally, nurses association in Indonesia will take care of the nurses. Why? Because nurses actually on high risk to get the infection of the COVID-19. There are some issues about the maybe economical issues, then mental issues, psychological issues. Previously, in the beginning of the pandemic, actually has knowledge issues. The nurses association will identify the need of the nurses and will occupy and will fulfill the need of the nurses. Then COVID-19 handling in Indonesia, COVID-19 pandemic here, the disaster management authorities actually this one, medical doctors, nurses, army, police, driver, pharmacy, dietitian, and others volunteer here. Okay, then the central government actually, this everything managed by the central government, but helped by the SARS or the task force of the COVID-19, the stressing, then testing and the treatment, then supply antiviral medication for COVID-19 patient, then provide health facilities, COVID-19 hospitals, activate all of the healthcare facilities for COVID-19, then provide COVID-19 vaccine for all Indonesian citizens, then provide COVID-19 budgeting. Actually, they come from the central government. Then for the national body of the disaster, they are responsible to control COVID-19 entirely, and establish a COVID-19 task force, then engage all the related professional and the public figures, then monitoring and reporting daily morbidity and the mortality, then establish an anti-hoax task force. This actually working together with the police and army also. Then facilitate the return of the Indonesian citizen from abroad or from other country. This might be related to the nurses association. There might be the committee aspect here. I to speak about this. Actually, nurses association has their own law. So the function actually only based on this law. Actually, the function of the nurses association actually as the forum that bring together nurses nationally and it's legal entity. Then based on the article 42, the function of nursing professional organization as unifies courses, then developers, then supervisors of the nursing in Indonesia. This actually include until today, during COVID-19 also nurses association implement this function, will supervise the nurses, will develop the something that can be resolved, find out that the problem solving for nurses. Then this is the role of the nurses association. Strengthening network between central representative council, regional representative council, and commissariat. Then strengthening the nurses' role in carrying COVID-19. Then advocate nurses who involve as SARS or just no task force for the COVID-19 to regional authorities. So ensure availability of the PPE or personal protection equipment at the healthcare facilities, include the in the public health center and the hospital. Then ensure availability hostel or hotel for COVID-19 nurses. Then distribute multivitamin for COVID-19 nurses. Actually, this to maintain the healthy and to prevent from the COVID-19 also. Then encourage hospital to provide enough rest time during their on duty. Then facilitate COVID-19 nurses to get official transportation because COVID-19 nurses working in Satgas or as a task force, actually not only in the hospital, not only in the public health clinic, but sometimes have to visit the village or maybe other communities. Then the Nurses Association in Indonesia also support some actions such as provide information and communication system for COVID-19 nurses security and rescue. Then monitoring nurses during pandemic. Actually there are links for monitoring and for communication. The distribution of the PPEs or personal protection equipments through regional branches. Then webinar to improve nurses competencies and knowledge. Then virtual room for Satgas or for the task force nurses COVID-19 in the association, the central of the association. Actually there are links. Then encourage central government to pay COVID-19 nurses incentive. This may be one issue that should be paid by the central government. That will need support from the Nurses Association. Encourage nurses for death insurance, and then encourage a negative stigma for the COVID-19 nurses because COVID-19 nurses basically in Indonesia sometimes will stay in the hostel or maybe in the hotel. And no, every day go back to their homes. That is maybe socially sometimes become an issue. Then nurses actually also recognized as the most of the healthcare personnel who become a pinpoint in frontline. The Nurses Association actually almost similar with the nurses activities itself. Based on the law, actually, include the assessment and conduct the nursing care plan in the hospital. That is the normal, and then evaluation, include the implementation of evaluation, then include the patient referral, specifically when nurses are working in the public health center on the remote region. Emergency responses according to the competency. Then consultation and collaboration with the medical doctors, health education and counseling, then management and administration based on the prescription. This actually Nurses Association also protect education for nurses. This is one protection from the Nurses Association to improve the knowledge. Then role modeling, then hotline education also provided. Then identify the nurses' need, then provide the supportive plan based on the need. Then coordinate with the stakeholder. In this context, actually, the central government and the task force of the COVID-19. Then coordinate, then identify infected nurse and coordinate for rewarding. And then create the link for monitoring COVID-19 nurses. Then for patient, for nurses who pass away because of the COVID-19, will facilitate the family reward and the study. Okay, thank you.
So thank you very much for showcasing the entire picture of Indonesia and letting us know about the gotong royong system of Indonesia as well as the Satgas and the Satgas nursing team. It was wonderful to hear from you about the Indonesian system, and we sincerely appreciate the role of the Nurses Association in fighting the COVID-19 pandemic. Thank you very much for your valuable presentation. Moving on to, we are moving on to the next speaker, Professor Datuk Florina Abdulla. She is the Pro-Chancellor of Lincoln University College, Malaysia. She is the first director of nursing at the Malaysian Ministry of Health and has served as registrar of Malaysian Nursing Board. It is our indeed pleasure in welcoming Professor Dr. Datuk Florina Abdulla to this webinar, and I'm inviting her to speak on the topic, role of research in addressing COVID-19 pandemic. Professor Dr. Abdulla, before we move ahead, I am requesting you to kindly stick to the time 15 minutes, please, because we are running a little late. Sorry for the inconvenience caused. Over to you, Dr. Abdulla.
Okay, thank you very much. Namaste, and good morning, I think, to you all in UK. And it is about 6:15 p.m. in Malaysia. Greeting from Lincoln University College. Thank you for inviting me for this to speak on this panel. I'm very happy because at least it's a platform for us to share what we are doing, against this pandemic, COVID-19 in the world. So basically, my paper actually, because I'm from the university, so it's mostly on a literature review on the role of research in addressing COVID-19 pandemic. Yeah? So actually, for me, because as I said, I'm from the university, so we speak about what is our role as a researcher, because we do have a department on research, and then looking at how the impact on the students, especially on the COVID-19, and also because the Ministry of Higher Education has given rules and regulation that the students are not supposed to attend classes now, and they're supposed to be, we are supposed to do online teaching and things like that at home. So this is why I'm saying that I'm speaking to a literature review, how best we can handle this. So we are looking at like social impact of COVID-19 on the student, and the public knowledge, attitudes and practices towards COVID-19, and many other things. So we are very happy because we do have these faculties, and every faculty has to look into research based on their discipline. So when we look at, we move back, one event prevailed the whole year of 2020, a deadly and previously unknown virus to wreak destruction across the globe, killing more than 1.5 million people, infecting many more, and causing economic devastation. And Malaysia is not spared. We are having an average of 200 COVID deaths daily, and so far we have about more than 10,000 deaths, which actually is not, we are not very proud of that. And we are looking at how we have to handle this. So everybody has a role to play, and especially in the university, even though we don't have classes, but then the researchers have to do something about this. So although there were other newsworthy research development in 2020, the pandemic set the course of science to an extraordinary degree. So researchers all over the world, us also, with us, are involved in battle against COVID-19, and their collective efforts contributes to the welfare of humanity. And basically that, whatever is the outcome, all the deliberations, we can share, especially in this platform. So the COVID-19 pandemic has brought to the fore the importance of a thriving scientific ecosystem for dealing with global crisis. So it's not the question of whether, it is rather a matter of when we will face such a pandemic. Was the warning issue actually by Mr. Larry Brilliant, an epidemiologist who helped in the eradication of smallpox. So the speed of the coronavirus spread has been matched only by the pace of scientific insights. So almost as soon as the SARS-COV-2 was discovered, research groups worldwide started probing its biology, while others developed diagnostic tests or investigated public health measures to control it. So scientists also raced to find treatments and create vaccines that could bring the pandemic under control. So when we can talk about vaccines, of course, we in Malaysia, we are all looking for some hopes, So how do we go from here? What are the treatments? So when the vaccine was introduced, of course, people, not all of them are receptive of this vaccination. But of course, we need them. So some of us, of course, need a speedy vaccines amid the chaos. A historic scientific effort has been given to world vaccines against a disease that humanity wasn't even aware of a year ago. So we are talking about this that last year we are not even talking about that. 2 years ago. So this is how we look at vaccine. Even though in Malaysia, I think we have already about 3 types of vaccine coming over, and Malaysia has this aspiration of having a herd immunity of at least 80%, 80% in the population, so that at least we can live with the virus sort of feeling a little bit safe. So COVID-19 vaccines have been developed and tested with breathtaking speed, actually, so fast, And at the last count in November, WHO has said there were more than 200 in development, roughly 50 of which are in various stages of clinical trials for the population. So researchers applied a vast array of approaches, from all school inoculation with chemically inactivated SARS-CoV-2 virus to newer technologies that have never been yielded licensed vaccine. So everybody is actually trying their best. So how has research contributed to dealing with the COVID-19 health crisis? Yeah? So this COVID-19 pandemic has brought to our attention how building up scientific temperament and propagation of scientific culture are critically important, yeah, to tackling a pandemic of this scale. It's basically the whole world. So the knowledge acquired can actually help us understand the very basics of the disease process and also helping us make progress in treating and also preventing it. So clinical research have a central role in the measures decided via a task force that advise the government at all steps of the crisis since the beginning. So we have these 4 people, they call it scientists, who will look at the situation now and the outcome. They will actually advise the government. So this is how we look at it in Malaysia. So research infrastructures and know-how is being deployed for the development of extra testing capacity, as well as development of research projects, yeah, and clinical trials in the university hospital, as well as the research centers. So these forms of uncertainty, actually, there are 3 forms of uncertainty when we talk about research. See, the COVID-19 pandemic has thrown the world into unexplored waters, yeah, and researchers are struggling, actually, to keep up with this rapidly changing landscape. So we are now facing a toxic brew of uncertainty. The pandemic has helped us to differentiate between these 3 forms of uncertainty. Yeah? First is about the risk. Then we talk about strict uncertainty and ignorance or non-knowledge. Yeah? So risk is a form of uncertainty with non-potential outcome in where the probability distribution is known. So when we talk about strict or fundamental uncertainty, it's a form of uncertainty where possible outcomes are known, but the probability distribution is unknown. The ignorance of non-knowledge represents forms of uncertainty where only some possible outcomes are known, while statistically likelihood of each of them is unknown. So basically there are 3 forms of uncertainty. So when we look at some of the examples, for example, we talk about risk uncertainty, we talk about the effects and side effects of new treatments, which we are not known. And when we talk about strict uncertainty, we talk about the pathogenic effect of SARS-CoV-2 in a different age group. There are so many examples here. I've just taken from these references. And we talk about ignorance, of course, about mutation, about treatment options, and unexpected obstacle to vaccine development and production. So this is the reference that I have as an example of the uncertainty that I've spoken just now. So what are these research that has been affected? So not since the Second World War has scientific research been disrupted so broadly, even media in Malaysia. As the virus started spreading across the countries, many universities closed their campuses. So many universities in Malaysia have closed their campuses. We have opened ours only on online basis, and as I said, doing on research. We have a few collaborative research with other countries looking at the social impact of COVID-19 on the livelihood and especially on the economy of the country. And laboratories also post all but most essential experiment. Field work was cancelled and conferences went basically virtual, like what we are doing now. So we are not exactly in the field to do the research. So in many fields not directly related to the pandemic, the projects and progress slot to a flow. So there's actually these challenges that we researchers are facing. And suddenly forced to work from home, the researchers found their lives very difficult and often struggling with family care and limited access to resources such as the libraries. Of course, we can go to the libraries, but some of the rural areas in Malaysia, we don't have that good access to the internet. So that is another challenge, especially when you want to search for information. And many students also found themselves without data from fieldwork or the lab that they needed to complete their degrees as well. So these are some of the challenges that we are facing in the university. And of course, the travel shutdown made job searches much more very difficult, of course, because of all these things. So what are we looking at? But in spite of all those challenges, there have been a few bright spots actually. So even the borders, even as borders close, some international collaboration open new avenues. We do have collaborative collaborative research with many countries at the moment, together with Clinton University College, which I'm very happy about. Okay, and researchers began to share data more openly, yeah, and many publish their work on preprint servers. Today, for the university, for Lincoln, we do have journals. Most have international indexes with scopus and things like that. From the Faculty of Nursing, from the Faculty of Business, from the Faculty of Medicine and Health Sciences. So we do have all these journals to publish our articles, okay? And actually that is one of the, at least we are happy about that. So most publishers make the public articles free to read. This is one of the benefits. And research culture also shifted, at least temporarily, away from emphasizing productivity and towards discussing broader issues such as work-life balance. Yeah, so we have sort of this paradigm shift. We look at a different approach now, and more on how do we balance, yeah, work and personal life. So research in this pandemic situation actually help us to support children and families when schools close or families are quarantined in their homes. Yeah, and to reduce the risk of negative mental health outcomes for children during confinement. The researcher recommended efforts such as close and open communication between children and parents, and web-based educational videos to promote a healthy lifestyle at home. So we try to maximize and make the most of what we have to have, to maintain mental stability. Yeah? And online services by psychologists to help children and adults to cope with the tension and anxiety. Yes. So basically, researchers actually have made efforts, yeah, to develop testing, therapeutics, and vaccine, and which I'm sure that is what we all are doing now. And I'm very happy to note that that there are people like you all are doing all this research, and how to find ways and means to make life more comfortable and more safe during this pandemic time. And of course, we have also, researchers also have continued to fight for funding. I understand that is another challenge, and for rigorous peer review of publications, of course. And they have, of course, organized online webinars, reference conferences, and training programs. And researchers also have provided scientific advice to governments and policymakers on outcomes of their research. And of course, they have played a vital role for public education and for countering misinformation that has arisen during the pandemic, especially with vaccine. There's a lot of misinformation, and some of them, they just refuse to have the vaccine, they just refuse this vaccination. And also, they have advocated equal rights and global solidarity. So basically, the Immunology Society, I call them, the researcher, now, they have this noble, ways of how to go about, doing research, finding out ways and means to make life more comfortable. So in conclusion, but as it has always with almost everyone, the pandemic has also affected researchers' working and personal life. Many of those who do not study the virus or its impact have had their projects delayed, the careers put on hold, and research funding disrupted. And as every new pandemic is unique in many ways, there are lessons to be learned from a significant body of literature on the psychological and behavioral health responses and consequences of the disaster events. And COVID-19 actually has blatantly highlighted the fundamental role of research for public health action. And future research focus considering the present times will undoubtedly include studies addressing the interaction of COVID-19 with other infectious disease, because most of the death in Malaysia actually also occur to those patients who have pre-existing condition like hypertension, okay, and then diabetes, and also heart problems. So we have to study the interaction of COVID-19 to all these non-infectious and also infectious disease like tuberculosis. So the pandemic has brought diverse sectors together in solidarity, like what we are doing now, and a noticeable trend within various medical disciplines that all seek deeper insights into the pathogenesis of COVID-19. So basically, that is what I like to say this afternoon. Basically, a literature review from the university section. Thank you very much.
Thank you, Dr. Abdulla, for a valuable presentation. It was absolutely wonderfully presented the strategies undertaken by the Malaysian government and the role the researchers has played in fighting this COVID-19 pandemic. And certainly, wonderfully, you explained about the three forms of uncertainty: the risk, strict uncertainty, and the ignorance. And it ultimately, reminded me also that the challenges that we all faced while conducting the clinical research trials in the COVID-19 pandemic. Such a great presentation for you. Thank you very much for this excellent presentation. Sincere thanks from the Global Health Network team. To move on, may I invite our speaker from Bangladesh, Dr. Sandra Rumi Mathu. She's a principal of Bangladesh Adventist Nursing College, Bangladesh. She has been a senior instructor for the Developing Midwives Project in Barak University and a study nurse in ICCDR, and she holds a PhD in health science and a master's degree in public health and clinical social welfare. It is my indeed It is my indeed pleasure in welcoming Dr. Sandra Rumi Mathu in discussing the topic role of nursing students in Bangladesh in tackling COVID-19 pandemic. May I request Dr. Sandra to kindly stick to 15 minutes, lesser than 15 minutes, so that we can close at the right time. Over to you, Dr. Sandra. Thank you.
Thank you, Sir Joby. So, welcome to Bangladesh, the land of fertile and also the land of river. You can see the red and green, we represent the Bangladesh. So for the pandemic era, we must wear the mask and social distance maintenance to protect from the coronavirus. So today, I'm sharing with you what is the field says about the nurses, what is their feelings and what they want to say and how they overcome. And they are overcoming the coronavirus pandemic in this era. So let's share the experience of nurses in navigating the practical challenge during the COVID pandemic in Bangladesh. So here we can see the source from the Johns Hopkins University. They gave a statistic that shape of the pandemic in parts of the Asia. So in Bangladesh, we can see here the 12,000 people, they are affected, and also the countries having more and more coronavirus affected person in Bangladesh. So here, the nurses having the greater role in this era. So we can see that the challenges Bangladesh nurses are facing. The coronavirus pandemic has caused increasing challenges for healthcare professionals globally, including the Bangladesh. There are some challenges faced by nurses during the COVID outbreak. So I want to give the overview that how that Bangladeshi nurses with their speaking, how they are facing the challenges. So with the heavy workload, one statement is from the nurses that since we have completed our nursing degree, so we are supposed to be psychologically well equipped to serve the people in medical emergencies. But at the very beginning of the coronavirus outbreak, many of us suffered from the fear of infection and were too afraid to come to work. This decline in the regular number of nurses create too much workload for us. So the practical situation is that they're having much workload and the fear of the infection to tackle the situation. And the lack of PPE and the training for the use. The nurses' comment was from the field that at first lot, we were provided with a huge number of poor quality PPEs, which made us pandemic situation more vulnerable for the health professionals like us. But as of now, we have steady supply of good quality PPEs, which can efficiently protect us from this virus. From my perception, there is no lack of PPE in present condition. So with the low social acceptance is a very negative thing for the pandemic era for the nurses. Actually, I feel deeply disturbed when I talk with the issue of social acceptance. When I started serving contagious patients during this pandemic, people of my community threatened me in a way which made me feel like as a raped woman and crying. I'm just crying But I have taught myself enduring the pain and work as a frontline fighter against the deadly virus. So see, this is the situation in the field level, how they are facing the challenges for that. The mental health problems. We work with extreme fear and risk of infection, the risk of our lives, but we get no appreciation. People think only doctors are contributing to save lives. We nurses are always ignored and unpaid in this country. It's nothing new. So it's a huge problem, and it's a global problem also. So the Bangladeshi nurses are facing these mental health problems for serving the pandemic era, and lack of incentives. So this is like nothing new. We have seen that roster system in place of arrangement shift and of the health professionals in the government hospital. As a result, government hospital get 7 days after the completing 7 days shift with corona patient. Unfortunately, with the private clinic workers do not get any incentive like that. So don't get my meals from the hospital. So this is the critical situation. The nurses need to be protected like that way. But sometimes for this era, we are not well cubed with that, or nurtured with that working environment. So this is a crisis. Lack of coordination and the direction. It is needed to create, a statement is given by a nurse, it is needed to create a committee coordinating doctors, nurses, as well as the virologists who are specialized in providing guidelines in the context of how to handle the current COVID-19 situation in Bangladesh best. Instead, the government has created a task force containing disease unions and the other administrative personnel who possess no knowledge about the virus. So it is needed to create this is a statement to what we need. Coping strategies. I cope with the challenges faced in my workplace with the support of my family, colleagues, and firm belief on the Almighty plans for all of us. The support of my chosen ones and trust in the Almighty provides me with a sense of mental strength, encourage me to stay positive in current crisis. I also take mentally notes that this is my job and I must do it. If I become nervous in promoting my duties, and how would the general people survive? So this is the coping management strategies for this pandemic time. So see the pictures, and this is the state that how the student nurses are contributing in the pandemic time. The student conducted the awareness building program in the community, such as social distance maintenance, wearing masks, hand washing technique teaching. They went to community with the guidance of the teachers, and also they formed the little short groups, and they went to several communities and they taught that and they are continue teaching the community people how to wearing the mask and washing their hands and how to be protected themselves from the coronavirus. And they helped in the several COVID vaccination booths for the social distance management and awareness building program. Also, in the vaccination program, they also given the vaccinations to the clients, and this way the student nurses contribute themselves a lot to the healthcare system, and the continuously working as assistant nurse in the general wards due to the shortage of the workforce and the nurses in the general ward, because the specialist stream already contributed in the COVID specialist area. So there is huge lack of general wards in the nursing. So they are deploying themselves like that way, and they are contributing directly to the general wards, medicine and surgery wards. The students, nurses have the huge contribution to overcome the situation. And here you can see how they are managing all the things in the vaccination booths, and how they are preparing themselves for the hospitals, and also the contributing themselves, preparing themselves to go to the community for the teaching. And some of the recommendations of better management for the pandemic for the nurses, that we have to enhance skill manpower and logistics support, and specialize the strong team needed with the dissemination of adequate special knowledge and skills, doctor, nurses, virologists, and other supporting staffs. Specialist training such as PPV management, donning and offering, procedures, oxygen instruments handling like that. Because when the corona pandemic came to the Bangladesh and all over the country, we are not prepared ourselves like that way, such in our middle income country. Now this time in Bangladesh, we don't have such supplies to arrange ourselves. So that's why it needs, the nurses needs the special training and how to keep themselves protected, how to maintain themselves. So, and all the operation of the instruments, it needs to be, the nurses need to be taught like that, right? And the workload needs to be lessened, a proper coordination and access to the information as promised in the national health policy during this public health emergency should be put in practice to ensure the quality healthcare service. And also priority intervention areas, we have the lackings in Bangladesh, that the framework of the patient and staff safety, infection control and cultural aspect and community engagement. Each area of PIE framework showed previous ignored issue in current health system in Bangladesh. The adaptation of the PIE system helped identify critical health system issues, possible corrective actions, including proper planning and management of isolation and infected patients, and provision of adequate personal protective equipment are recommended to manage the policymakers to save the lives of healthcare care workers and to minimize the spread of the infection. And the recommendation also, the nurses needs to be supported with the adequate resources for both physical and mental health. Emergency management for pandemic needed to stress more in our teaching curriculum for the student nurses. They can prepare anytime themselves to devote themselves to the pandemic, to overcome the pandemic situation. And more research needs to be done from the bedside nurses to improve the management system of the pandemic situation in Bangladesh. As far you can see that no research work yet published to coronavirus pandemic from the bedside nurses from the Bangladesh. So it is truly needed to have the research paper and how the situation can be improved from the nursing care plan. And you can see that the pictures, our Prime Minister Sheikh Hasina, she is taking the vaccination from our nurses. And she is very fond of the nurses, and she is appreciating always the nurses to that we are having the great contribution for the country. And the windows of hope, how the nurses are doing themselves, that I feel very happy. The statement from a nurse, Nipa Paul, has working in the emergency department of the Cox's Hospital for 9 months. And she says that I feel very happy when a patient condition improves with the service we provide. Recently, a woman who had given birth at home was brought to our emergency department. She bled and she could not save her life. We could not save her life, even though we have all the facilities in Bangladesh hospitals to ensure the safe delivery. Many women are still giving birth at home. At the outset of the pandemic, we were scared because of the virus spread, but we have been serving COVID-19 patients since we are provided with PPE kits bedside. I always follow safety guidelines when I return home from the hospital and maintain a safe distance from my children. I don't tell my neighbors that sometimes we serve COVID-19 patients because they might panic. So this is a hope that how the nurses taking the encouragement to themselves and the windows of opportunity, windows of hope they are feeling, and we have to encourage them to work themselves to contribute more to for overcoming this situation. And we should overcome, and we shall overcome. Here, our Prime Minister encourages us that the nurses. And so when the vaccine came in Bangladesh, our nurse, she took first, because with the vaccination, we had some rumors in Bangladesh that if anyone can take this, they can die. So a brave nurse, she took first in Bangladesh, she took the vaccination, and our Prime Minister lively encouraged her to take the vaccination. It that broadcasted in our social media and also in our television. All the medias. So this is a wonderful opening of the vaccination in Bangladesh, and she contributed a lot and encouraged the population of Bangladesh and the nurses face to the Bangladesh and the world. So these are the reference, and this is my endings of the presentation. And thank you so much for your listening. And again, I welcome you all to the Bangladesh. And also I want to pray that every nurses can have the sound physical and mental health for overcoming this pandemic situation. Thank you so much.
Thank you, Dr. Sandra, for an excellent presentation. It was indeed a great opportunity for us to understand about the Bangladesh situation. Like any other professionals, the nursing students also have faced many hardships during this COVID-19 pandemic. Thank you very much once again for highlighting or showcasing about the Bangladesh situation. Moving on to our webinar, it is one of the greatest opportunity that we have put together 4 nurses, each from each region, to showcase their experiences, to share their experiences while working in COVID, the sacrifices that they have faced, the challenges, and a strong message to the healthcare community that they all should give. So let me invite, or let me welcome each nurse from each region. I am welcoming from India, Teresa Sebastian. Teresa is working as a clinical instructor in Jupiter Hospital in central part of India. I am welcoming Teresa. It is my great pleasure in welcoming a nurse from Malaysia, Sulma bin Abdul Hamid, to this webinar to share her experiences with us about the COVID-19 pandemic. It is my indeed pleasure in welcoming Ade Dila Ruri from Indonesia. She is a nurse, senior nurse and a ward manager in a hospital in Indonesia. Welcome, Ade Dila Ruri, to our webinar. Indeed, we are looking forward to hear from you. My greatest pleasure in welcoming Marina Jarin. She is a senior staff nurse working in one of the National Institute of Disease of Chest and Hospital in Bangladesh. Indeed, my great pleasure in welcoming all the 4 nurses into one single platform to share your experiences. Over to you, nurses, one by one. Thank you.
Warm greetings to one and all. Myself, Teresa, representing as critical care nurse from India. As we all know, we are finding ourselves in unsettling times because of COVID-19, declared as a global pandemic. It has resulted in significant burden globally. During this crisis, healthcare workers have faced several challenges treating patients with COVID-19. Regardless of the fact that nurses are trained to think and act steadily in any emergency, we had to cope with different psychological challenges, including anxiety, insomnia, depression, fear of sudden death. Fear and uncertainty about the health were taking an emotional toll on nurses and their family members, leading to quit their jobs even. We are going through a remarkable journey with an uncertain destiny. There was not enough time given to us and prepare for ourselves to fight this battle. The most challenging part for entire healthcare system faced that was there were no literature available, no ready SOPs. All we were following the hospital guidelines with reference to WHO. But the guidelines kept changing continuously since disease is new to the science world. We were uncertain about the line of treatment, mostly depending on trials and improvisation. What seems more daunting was to deal with the feeling of helplessness, seeing patients in an anxiety and desperate situation, sitting in an isolated room, and there was nothing we can do more about it, maybe the last resort of the treatment. And it was the most difficult thing we dealt with. How much ever the world has come advanced in terms of technology and telecommunication, it will never surpass the human touch they require during the last days of their life. Some were not even lucky to bid goodbye and perform last rites for their loved ones, what they deserve for. And that was absolutely heart-wrenching. Imagining ourselves and our loved ones in that situation was way beyond our thoughts. We were committing ourselves to serve as a good companion for the best recovery of the patient. As the demand of the nurses were rising due to the sudden surge in patients getting admitted, we were striving our best to overcome this inadequacy by placing the last year nursing students to practical areas. There was huge logistic challenge regarding transportation during the lockdown period. Yet again, many nurses were ready to sacrifice by staying away from their families for months to extend their care toward patients. In the way of rendering the spirit of compassion and humanity, many of our colleagues lost their lives, and this was an ultimate sacrifice. During the shifts, they had heavy workload, extreme exhaustion, and tiredness due to the extended working hours. Maybe even they don't know the lack of knowledge about how to use a PP kit, and another arduous challenge. Wasn't going easy to wear the attire for more than 12 hours. The common problems what we faced were drenched in sweat, leading to dehydration, fainting episodes, prolonged use of N95 mask leading to suffocation, breathlessness. Fogging of the goggles and facial was causing limited visibility, hindering in the delivery of care. Pressure masks on the nasal bridge and ear ridge was causing another trouble. And due to the humid environment, we were having skin rashes, itching, leading to dermatitis, even to the extent of difficulty in walking with the jumpsuits, holding a pen with a glove hat, and lot many. It was far more challenging when it came to female nurses when they were in the biologic clock, attended to nature's call was a tedious job. Breaks during shifts was given, which was a huge relief and helped to surpass these issues. It was even more difficult for patients to recognize the staff in this attire, feeling scared when they looked at us. So we found alternatives by writing our names and designation on PPE kits, and it helped in addressing our colleagues also easily. Difficulty in hearing and understanding the speech was another issue we overcome by devising the sign language and actions. We used to even face difficulty in performing certain procedures of intubation, effective CPR with the PPE kits on, but we were not compromising on the care. The proning was another tedious task. At different intervals, we need to prone the patient as many were on ventilators, leading to extreme exhaustion and fatigue. Fortunately, the backup and the support system provided by the organization helped us to overcome these obstacles. Training session regarding the proper use of PPE, donning and doffing, isolation practice helped us to boost the confidence to work fearlessly. And to mitigate the other challenges, many sessions on yoga, meditation, breathing exercises, psychological telecounseling were conducted to take the mental health care across the medical fraternity. As nurses are the key players in stopping the pandemic with adequate assistance, what all we needed was the ability to cope with the stresses and positively adapt to the adversities. But like Phoenix, we rose from the obstacles and afloat with the best medical practices. To my all nurses, my citizens, continue the spirit of compassion and empathy towards the patient. In any life-altering situation, not to forget our strength and weakness, and to be ready for any crisis coming our way. So as a responsible citizen of this country, we need to be aware of the fundamental duties by following guidelines laid down by the authorities and get vaccinated too. That's what my message is. Thank you all.
Thank you, Teresa, very much for your indeed great testimony. It is indeed great to hear from you, and thank you very much for your valuable time. And since we can see that our nurse from Malaysia, Hamid, is already in PP, I think we shall give him a priority. Over to you, Hamid, to just help them, let the world hear about your testimony working in COVID in very short time period. Sorry that we are running a little late time. So please stick to the time. Over to you, Hamid.
Okay, thank you, Mr. Joby George. My name is Johan Bibi Abdul Hamid. I'm working as a nurse in Hospital Klang, in Hospital Tengku Ampar Rahimah Klang, which is one of the biggest and the busiest hospital in Selangor. So working as a nurse during this COVID pandemic are really changing our daily routine. An example, when we coming to the working shift, we have to wearing a PPE for a very long time, which is before this, most of the ward, clean ward are changed to the COVID ward. It's a really challenging for the nurses because with the restriction of the human resource, we have to deploy our nurses from the other discipline, from the other department who working in the COVID unit. It's a very difficult for the nurses who are in the specific or sub-specializing area, which is like operation theatre, ophthalmology, which is they are deployed to the COVID ward. It takes time for them to adapt to the new environment and with this new challenges. So in other hand, combating COVID is not just combating with the virus, but we also combating with our own feeling, because every day we are going to dealing with the patient having a shortness of breath, difficulty in breathing, and most of the what can I say, in every day we are dealing with the dead people, which is very stressful. We have to be strong enough to dealing with all this situation, because However, when to adapt with this kind of situation, we need a good support from our colleagues because working in an example, our superior and medical officer and our specialists are giving a very good continuous monitoring, giving a very motivation to our nurses in order to make sure the nurses are capable to continue their routine jobs. So as a frontliner, what can I say? As a frontliner, as a nurses, medical assistant, and medical officer, what can I say? You all you keep strong, keep positive. May Allah be with you. Thank you.
Thank you, Hamid from Malaysia. It was indeed. I must rather say that I must appreciate and that the time that you took in spite of continuing your duty is really commendable and appreciated. The Global Health Network sincerely applauds your valuable contribution to the entire country. It is my indeed pleasure in welcoming De Dilaruri from Indonesia. Please share your experiences and your testimony. Yes.
Bibi?
Yeah.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Selamat sore. I want to thank Mr. Joby and Tukiman who have given such an honor for me to share my experience dealing with COVID-19 patient. The first year of COVID-19 break, I learned and did a case study to dig more about this disease, how the patient doesn't only need curative and physical care from doctor and nurse, but they also need a sense of, okay, one of the patient really appreciate the way the nurse delivery care and communicate with sense of humor with them. We also reminded the patient that more than 90% were recovered well. They said it means a lot the thought that this disease is deadly, as it is spread from hosts. One of our patients also did a funny things during her treatment. A lady, 63 years old, who likes gardening, 3 days of hospitalization, we found out that she tried to peer out from a narrow opening under her door. She said she wanted to find and feel the sunshine on her skin. We see the patients who are being isolated become stressed and more on their COVID-19 disease. So we propose to their management to make a mini park behind the isolation room where the COVID-19 patient can do sunbath, do light exercise, and chit-chat with other patients in an open space, free and fresh air. But only one isolation was possible to have park, while other 2 can't. Roughly, I saw the happy faces is quite a lot in the world with a mini park. Then the other one that doesn't have the mini Jurassic Park. But it requires more research. So we as a nurse, especially who work in public hospital, most of the time focus more on physical aspect. We overlook the effect of psychological aspect in human. Moreover, anxiety and fear are the recently rise among the patient pandemic. We must put in our mind that the brain, the center of cognitive and feeling, play a big role in how our body works. When our brain said this disease is death sentence, the body adjusting that make the disease end bad. As a nurse, we ourselves are tired and burnt out with the situation, lack in all aspects. The number of nurses in both meaning quality and quantity, lack of PPE, lack of facility, rapid change of regulation and protocol, the pressure from patient and family complaining about isolation room, the protest from patient related with funeral procedure, and so forth. Therefore, it is important that nurse and COVID-19 work, care, and have a self-compassion with themselves, because only nurse who care and love with themselves have empathy to others, especially the patient who are in need in their care. COVID-19 is a contagious disease indeed. However, happiness is more contagious than COVID-19. A happy nurse will transfer patient happiness with their patient and transfer an immune system for them. So nurse, don't forget to be happy and proud with what you've done as a nurse. Thank you.
Thank you, nurse from Indonesia, De Dilaruri. Thank you very much for sharing your hardships that you have faced during the COVID-19. It will be really an inspiration to the many novice nurses that they are who are willing to take the nursing in the days to come. And thank you very much once again. May I invite the senior staff nurse working in National Institute of Disease and Chest Hospital in Bangladesh, Maria Jarin, to share her experiences working in COVID in not greater than 3 minutes.
Thank you so much. Assalamualaikum and good day. I'm Marina Zain, working as a senior staff nurse in National Chest and Diseases Hospital, Mohakhali, Dhaka. Actually, like also whole world, we are also suffering from this pandemic actually. And when I heard that I have to work in the COVID ward, this is really very worrying thing for me, as because this is difficult to cope for all the nurses at our not only at our country but also for whole world. The problem is same. Although when I started working, it was, I feel like really proud, as because I saw the suffering. And on day on patient who is only 32 years old and his saturation is less than 80 with 8 to 10 liter oxygen, and he asked me that am I gonna die? And for a moment I felt like I'm speechless, what I'm gonna say to him. I can't give him false reassurance, but I also give him some sort of assurance so that he become mentally stable. Also, I saw more than 3 deaths in my own shift, and then I feel really mentally devastated that I didn't see this much death in one shift actually. So yes, this is very difficult for me at first time. And the challenge I really faced that I started working when at a COVID ward. Actually, I don't have any kind of what I can say, but any kind of training I didn't get actually. We don't have so much many documents on what we can work, and we know lots of things about, as because it's also it's in research process actually. But I'm really worried about my family so that they are not become infected as for me. And you know, I have a very little child. I am also worried about her. So I'm really felt like what gonna happen actually. And also the challenge is when I start working that in our country this is so much hot, and working for a long time with PPE or without air conditioning room, this is really difficult actually. Also the communication become difficult. We work by our sign language, but the thing happened positive that our team working become very strong. And the challenges I also faced that I didn't get vaccinated when I started working, but after working 3 or 4 months I get the vaccine, as because the first time vaccine was not very available at our country. But now I am vaccinated actually. And I think that the thing when we started working at COVID ward, this is really difficult that we are not want to meet with our parents who are very old age actually. Like I didn't meet with my mom for more than 10 months. She's an asthmatic patient. Also, I have to make distance with my family members when I came to home actually. So yeah, those are lots of things that we have to face. But the positive thing is now we are seeing that the death rate becoming very low actually in our country, and the infection rate is yes, this is also nowadays becoming low. And I will like to say all of my colleagues and full world, my mates, that I want to send hugs and laughs for all of them, that we are really working in crisis situation. And at last, I would like to say that I didn't see the freedom fight of Bangladesh, which was held on 71, but I really see the COVID-19 pandemic. And yes, we are working as a frontliner fighters. Thank you so much.
Thank you, Maria Jarin, for your testimony. It is, I think that the nurses like Teresa Ahmed and Ade Dilaruri and Maria Jarin, You were represented all the 4 Asian countries, and it is indeed a great great work that you all have paid. And from the bottom of my heart, I am expressing my heartfelt salute to you all for all the hardships that you have done. And indeed, we will surely overcome this. And the Global Health Network sincerely applauds and thought that it is the one way of appreciating you guys is like this, by coming into one single platform. We sincerely appreciate your hardships and work. May God bless you all and stay safe and take care of your family as well. And you are the messengers of your country. And may God bless you all. Thank you very much. Have a great evening to you all. Thank you. As we move on to the closure of today's webinar, I take this opportunity, and it is my entire pleasure in chairing the session for this webinar. And I think that yesterday I have not slept, because this was a webinar that I was planning since 2020. However, I couldn't organize it because of many challenges. Twice I wrote to all the 4 speakers which are assembled here, but I couldn't have that much ability to send that, because I thought that the hardships that they are facing. So I was trying to just come this situation to the normal situation to start this webinar, and the time has came. And it is indeed my great pleasure in once again chairing this session, the first of its webinar in chairing the session. And I'm taking the opportunity for all the 4 speakers that we shall collaborate with each other in terms of research capacity development. The Global Health Network sincerely applauds, and we are ready to work with all the potential 4 Asian countries to increase the research capacity development. My sincere thanks to the director of the Global Health Network, Professor Trudy Lang, the Global Health Network colleagues, including Emma, Arancha, Nicole, and Bonnie, and the entire technical and entire operations team of the Global Health Network. My sincere thanks to the Global Health Network team. My gratitude to the experts from all the 4 Asian countries. Special thanks to Captain Dr. Usha Banerjee from India, Professor Dr. Abdulla from Malaysia, Dr. Tukimin from Indonesia, and Dr. Sandra from Bangladesh. Also, my special thanks to Lina, who is the Director of International Marketing, and Secretary to Dr. Abdulla for managing her schedules. And it is indeed a great challenge that I shall accommodate all the 4 speakers into one single platform. That was my indeed great challenge, but I am confident that I shall overcome this. And I have overcome that. So my sincere thanks to all the 4 speakers and all the messengers who have forwarded this webinar to, I think, hundreds of nurses from all these 4 regions. My sincere thanks to the 4 nurses who have been shared their testimony in spite of their tough schedule. Thank you very much. It is indeed my great pleasure once again in hosting this. Thank you each and everyone. Good evening. Thank you. Namaste. Shabba Khair. Khuda Hafiz. Thank you.